Welcome to the Journal Editorial Report. I'm David Asman in this week for Paul Gigot. Well, COVID-19 cases fueled by the fast-spreading but less virulent Omicron variant continuing to spike all over the country, with the U.S. smashing previous records for new infections this week amid an ongoing testing shortage and increasing frustration over what critics are calling mixed messages from the administration. Some former advisors calling on President Biden to shift his focus from defeating the virus to learning to live with it. But the president said yesterday that he doesn't think COVID as we know it is here to stay. Listen.
I don't think COVID is here to stay. That having COVID in the environment here and in the world is probably here to stay. But COVID, as we're dealing with it now, is not here to stay. The new normal doesn't have to be. We have so many more tools we're developing and continuing to develop that can contain COVID and other strains of COVID.
Dr. Qanta Ahmed is pulmonologist at NYU Langone and a senior fellow at the Independent Women's Forum. Doctor, great to see you again. Thank you for being here. We'll get to the mixed messages in just a minute. But first of all, on Omicron itself, we saw in South Africa that it was kind of like a wildfire. It burned very quickly through the population, but burned out fairly quickly as well. Is the same likely to happen here, or has it begun happening already?
So South Africa gives us a great template. You're absolutely correct. And we do expect that this burden of infection is going to decrease by late January. I'm thinking mid-February. We're seeing many more people catch the infection. All of us know somebody who's caught it. Our patients are catching it. But it's very different in presentation. Sore throat, hoarse voice, coughs and colds, particularly for those who've been fully vaccinated. There are those individuals not vaccinated who can become seriously ill. So I think, yes, we're going to see a sharp peak and then a sharp descent. But we can't be complacent. We are not South Africa. We have a very significant aging population. We have some of the highest rates of obesity in the world. And we have a lot of comorbidities, diabetes, hypertension, stroke. All of these add to our greater vulnerability to an infection.
What about deaths and hospitalizations specifically? Again, you mentioned the differences between South Africa and the U.S., but South Africa did have surprisingly low number of hospitalizations and deaths, even though I believe a majority of that population was not vaccinated.
Exactly. So 70% of South Africans didn't have the vaccine. Here we are 62% nationwide and over 70% in New York State. And you're absolutely right. There's a strong decoupling of the number of infections and the number of hospitalizations. So very few people who are catching the infection need hospital level of care or even outpatient level of care. So that's true. We're seeing a different kind of COVID-19. We refer to it at NYU as an incidental COVID-19. I am allowed to tell you, with NYU's permission, that 65% of people across our hospital system that have COVID-19 are actually admitted for some other reason. They come in for various other reasons. We screen them and we find they're positive. So people are not showing manifestations of disease, but we're finding that they're positive. And we're going to start learning about that. With President Biden, I don't envy his job. He's got a very difficult job to do, as any president has. But we really have to recognize we are not yet at a point where COVID-19 is endemic. In plain English, that means it's not yet permanently embedded in our ecosystem. We are going to have more episodes. And if we prepare Americans properly, they won't be as disappointed and crushed and exhausted as many of us, even in the healthcare field, are feeling. One of the things we need to do, and he is moving on that, is accessing rapid tests. Everybody should be able to access a rapid test anytime. Even as doctors, it's been hard to get that. That gets
I was going to ask you about that, Doctor. I mean, the fact is we've spent a lot of money, trillions of dollars in COVID relief over the past couple of years now. One would think that one place that they would be spending that money would be in the rapid testing. I mean, why? How long does it take?
Agree.
How long does it take to roll these things out?
I absolutely agree. I think it shows that there's been a flat-footed response because rapid tests are widely available where my family live in Britain, where my colleagues are practicing in the Middle East, and other places in Europe. So we've been very slow at that. And so I can't say how it could have been improved, but it should have been escalated faster, for sure. And also, people should have been given more autonomy. The more we teach people about this infection, the better they're going to be. The vaccines most definitely save lives. Most definitely. I worked in the first wave in the intensive care units with very high level of mortality, very few people surviving that first kind of infection when we had no therapeutics and no vaccine. Those individuals who've been fully vaccinated, having all 3 shots, have almost 20 times, that's 20,000% lower risk of dying from the infection. It's a massive benefit.
What about the therapeutics, Doctor? Forgive me for jumping in, but the therapeutics themselves, particularly monoclonal antibodies, I know that not all of them work against Omicron as well as they did against Delta and the other variants, but we need more of those. And I know some hospitals, I know of a hospital in Westchester that has 0 monoclonal antibodies, and these new drugs, the Pfizer drug, the Merck drug that you can take in pill form. How soon do you expect those therapeutics to come online or to be available again?
So my hope is that they will come rapidly available. I know some of them have been FDA approved, and it's difficult to know why established therapies, for instance, Regeneron was the first one to be noticed, are difficult to access. And some of that has been, I think, a very heavy focus on vaccination, possibly without giving the same attention to therapeutics. And so vaccination is very important. And we are in a much better position than we were 2 years ago, and that is only going to continue to improve. One of the vulnerabilities, Dave, I'm very worried about, and it's not been emphasized, is there are many things we can do preventatively. And I don't mean hand hygiene and masks. Obviously, that helps, that mitigates. But being as healthy as we can, lowering body mass, becoming physically active, going outdoors. With all of the restrictions that we've experienced in New York State, many of my patients are developing obesity. They are developing depression. They are developing major health problems, mental health disorders because of these restrictions. And that is a huge healthcare burden that's not being recognized.
Yeah,
the same thing with children.
I was going to say, particularly with children. We're going to get into that later in the program. I'm so sorry, but we've run out of time completely, but you are extremely helpful to us. Doctor, thank you so much for being here. Really appreciate it.